Most of the ladies will be suffering from certain menstrual disorders, so like irregular cycles, that is either a delayed cycle or early onset of cycle. Generally it will be 28 to 30 days. Every menstrual cycle will be of 28 to 30 days, and even it may be delayed even more than 40-45 days or even some months together, or otherwise it may happen even early, like even 15 days or 20 days they may get the menstrual cycle. So this is one issue. Second thing is bleeding. Excessive bleeding will be there, may continue for 8 days or 10 days or even 15 days. So third thing is abdominal pain. So abdominal pain, again especially during the menstrual cycle, they may have this pain for a few days, even for 1 week. And so one more important thing is that they suffer is infertility. Any of these complaints, so when they consult any doctor, generally doctors advise to undergo scan, that is ultrasound scan of pelvis, abdomen and pelvic scan. So most of the females will be showing one common finding, that is uterine fibroid. So what is this uterine fibroid? Uterine fibroids are nothing but small hard tissues so within this uterus. So these uterine fibroids are generally seen during the childbearing age, that is from menarche to the menopause. So it is not seen among the children, and also it's not seen so once the woman attains the menopause. That means to say these fibroids are related to the hormones, that is the hormonal variation is causing these fibroids. That is why it is not seen in children as well as in women, elderly women. These uterine fibroids are so very common. Almost 80% of the women will suffer this uterine fibroids so during their childbearing age. These fibroids may be single or even they may be so multiple. So what are the clinical features? What are the findings if the woman is having any uterine fibroid? So first thing is irregular cycle. It may be delayed. The cycle may be delayed, or they may get the cycles very early within 15 or 20 days. So next is the bleeding. Excessive flow will be there. So for about 8 days or 10 days or even 15 days. So bleeding will be there after the menstrual cycle. Third thing is the pain. Pain, again the pelvic pain. It could be a pelvic pain, or it could be an abdominal pain, or it could be a lower back pain. So when the size of the uterine fibroid is quite larger, it compresses, it puts pressure over the over the bladder, resulting in urinary incontinence. Then when it puts pressure over the intestines, it results in a constipation. We may see this urinary incontinence as well as the constipation when the size of the uterine fibroid is quite larger. Then what is the cause? What is the reason of having these uterine fibroids? Actually speaking, the exact reason is not known, but there are certain factors which are contributing to this uterine fibroid. So mainly it is hormonal imbalance. It's seen during the hormonal period. So it's an hormonal imbalance. So hormonal imbalance, a risk factor for this hormonal imbalance are, one thing is, first is obesity. Excessive weight is one reason. Second is vitamin deficiency, especially among that vitamin D deficiency. Then excessive non-vegetarian food, excessive meat can also cause this uterine fibroids. Then so low fiber diet as well as excessive alcohol, even alcohol consumption can also result in uterine fibroids. Vitamin again along with the vitamin D, even vitamin A deficiency can also contribute for this uterine fibroids. Along with the vitamin, certain mineral deficiency like calcium deficiency, magnesium deficiency as well as the phosphorus deficiency can also contribute to this uterine fibroids. Then what is the treatment? Generally doctors keep advising you to take the tablets, that is the hormonal tablets, estrogen, progesterone tablets. Otherwise, if it is quite larger, some may advise you to undergo surgery. So the reason for undergoing surgery is they say that it may turn into cancer. So, but not 100%, 200%. These uterine fibroids are so benign and they never turn into malignancy. They won't turn into a cancer. So first thing is that tablets are not necessary. You need not take a tablet to balance your hormones. See, because you may take the tablets for 1 month, 2 months or 3 months. At that time, your hormonal level may get balanced, but after 3 months, there will be irregularity, imbalance in your hormones results in again the uterine fibroids, or else the size of the uterine fibroid may increase once you stop the hormonal tablet. We can get rid of these uterine fibroids naturally without going for any medicines or surgery. How is this possible? So first thing is you need to keep your mind calm. Hormonal imbalance. So hormones has to be balanced. First thing what you need to do is mind need to be kept calm. Do meditation. Regular meditation helps you. Consistency in meditation, not doing it for few days and again stopping it. Meditation has to be done regularly. Second thing is exercise, regular exercise like Surya Namaskar, Pranayam, all these things definitely they help. Third thing is regular walk. So morning and evening, 2 times walk also helps. So meditation, exercise as well as a regular walk. Certain factors like coffee as well as the tea also trigger are also contributing to this uterine fibroid. So avoid, if you are having uterine fibroid, better to avoid the coffee as well as tea intake. Third thing is the obesity is one of the most common cause. You're supposed to reduce your weight not with medicines naturally, just with the diet and exercise, reduce your weight. Then vitamin deficiencies, vitamin D deficiency again, vitamin D we get in the sunlight. So everyday exposure to sunlight for about 15 to 20 minutes will we get the vitamin D. And vitamin A deficiency, vitamin A we get from getting the food from the vegetables as well as the fruits. So plenty of fruits and vegetables as well as getting exposed to sunlight for about 15 to 20 minutes a day will help to provide the vitamin A as well as vitamin D, and it helps to suppress these uterine fibroids. Certain minerals like calcium, magnesium, phosphorus deficiency also results in this uterine fibroid, and we get these minerals in the vegetables. So mixed vegetables every day, so along with that green leafy vegetables. So this helps to this provides the minerals and also helps to suppress this uterine fibroid. Alcohol consumption is one of the major cause. So avoid or completely stop consuming the alcohol if you are suffering from uterine fibroid. The non-vegetarian food is also one of the reasons. So stop using the non-vegetarian food. So whether it's a chicken or mutton, you must avoid. You must stop it if you are suffering from uterine fibroid along with this irregularities in your menstrual cycle. Then we need to take more fibrous food. We get more fiber in fruits as well as vegetables. So reduce the quantity of grains, then increase the quantity of fruits and vegetables. Due to excessive bleeding, you might be suffering from iron deficiency. In such cases, you need to take iron supplements that to temporary for 2 to 3 months. Once you attain menopause, definitely these uterine fibroids they shrink in size and completely they disappear after certain time. So there is no medicine for this one, and avoid taking medicines as well as avoid surgeries for uterine fibroids. So 99% of the times you don't need any medications or surgery. Only 1% of the women may need treatment like medicine, tablet or surgery. That too when the size of the uterine fibroid is too large, compressing over so other organs, or otherwise the subserosal uterine fibroid which is projecting into the uterine cavity. If you need a precise and scientific information about health, then only subscribe to our channel. Namaste.